my name is Allison Long and welcome to this week's USF Health Brief. Once again, looking at the continuing effects of COVID-19. Today we welcome Donna Peterson, Dean of USF Health College of Public Health. She will discuss how COVID-19 is changing how USF and the community in general reacts to pandemics. Welcome, Dr. Peterson.
Thank you, Allison.
You are in charge of opening the campus. Can you explain the four-phase approach to reopening the campus for faculty, students, and staff?
Sure. So we modeled our plan after other plans that I'm sure people have seen out of the White House, other institutions that suggest a phase-in approach. And the reason for that is because we've not been out and about, most of us have been home, not going to work. When you suddenly introduce more people into the community, you increase the potential that the virus could spread because the virus is still with us in our community. And so we've kicked off phase one. We hope to quickly get to phase two. We're going to pay very close attention to any impact that our coming back has on the larger community and the spread of COVID-19. But again, we believe that all the mitigation measures we put in place, hand sanitizer, disinfectant wipes, distancing, we've reconfigured spaces. People will be required to wear face coverings in any shared enclosed space. If everyone can do that, we believe we can successfully move into phase three and get back to some semblance of business in the fall. The fourth phase, the last phase, doesn't happen until COVID-19 is no longer a threat. So until we have a vaccine or herd immunity, we're not in phase four. So we're going to be in phase three for a long time, which means we're not 100% back, we're not 100% face-to-face, we're not 100% having events, but there'll be enough activity that we think everyone will feel like they're back on campus. Right. Life is good.
I will be happy to see the students back on campus. I must admit. I do miss them.
We all miss our students.
How important are face masks to fighting COVID-19?
So the one thing about a new virus, which this is, not new on the planet, but new to humans, is we've had to learn about it, get to know it. And so I know people always get frustrated when the advice seems to change, but I think the face covering advice, now that we've finally been clear on it, the more we learn how important that is. So our goal, of course, is to reduce transmission of the virus, prevent severe illness, prevent mortality, prevent an overwhelming of our healthcare system. That's what we're trying to do. Face coverings with distance is the best strategy we have. It is the best tool we have. The only thing we can do is engage in the behaviors that will enable us all to contribute to a reduction in the spread of the virus.
How has USF Health epidemiologists contributed to the fight against COVID-19?
The College of Public Health in particular, where the epidemiology programs are and where we have a lot of students in our epi programs, they reached out to the schools and said we need to hire 150 people quickly to help us do contact tracing, and the USF College of Public Health, I'm very proud to say, contributed half of those.
Very impressive.
Yeah, so students, a few faculty, a few staff stepped up, said I'm willing to help, I'm willing to support this effort. Contact tracing is the responsibility of the Florida Department of Health. It's in statute, and it's what we do in any infectious disease, meaning whenever we identify a case, we want to quickly identify anyone who's been in close contact with that person and isolate all of them to prevent the spread. So it's a very important part of infectious disease control. It's a basic part of public health, and we were happy to be able to contribute.
How has this changed curriculum for USF Health?
We are preparing our students in the College of Public Health and across USF Health through all of our interprofessional education activities. We are preparing them for these kinds of events. I think the one thing that is new to this particular pandemic is the pervasiveness of media, Facebook, Instagram. People are exchanging information in real time in ways that we've not ever seen before. That's the one thing that sticks out at me, that we need to think harder about how we help our students appreciate that reality and maneuver through it. Because at the end of the day, we need good, solid information out there that the public trusts and that they can then act on.
Thank you for spending time with us today, and please tune in next Tuesday when I talk with USF Health's Dean of the College of Pharmacy, Dr. Kevin Sneed, about how the pandemic is affecting the development and dispensing of medications.